Hello, everyone. Good evening. You're welcome to Dr. Evening's Live today. And we have a whole new topic. I want to thank everyone present here and those who have been on this live in the last section. So today we have a whole new topic, and the topic is living well with kidney disease, dietary and lifestyle modifications, Kidney Health Series 101. So I'll be sharing my slides now. So this is the topic: living well with kidney disease, dietary and lifestyle modifications. So we're going to have this particular topic in two sections, one this week and another one the next week, because I want to dissect lifestyle modification in kidney disease. A lot of people think once you have a kidney disease, it is a straight life sentence. Yes, it is adults, and the treatment can be difficult, management can be difficult. But with help and guidance, I've got in my experience, I've seen a lot of patients who have done well living with kidney diseases. So the idea here is that I'm able to dissect this topic in a way that everyone, including those living with kidney disease, those living without kidney disease, will be able to understand how to function well with the disease. Somehow, I'm sure you have someone in your environment, even if it's not a family member, somebody in your environment, somebody you've heard of, who may have kidney disease. And then, of course, the lifestyle we're talking about here would also add to the preventive measures for people who don't have the problem yet. So we would go on. Thank you again for listening. You can go on to subscribe to this channel. You can invite other people. Please share the slides, share the link to everyone. Subscribe to our Facebook channel, YouTube channel, our WhatsApp channel. Just subscribe everywhere and continue to join us, because this is educative and it's helping improve people's quality of life and even improve lifespan and improve mobility of people. So these are the learning objectives. We're going to define chronic kidney disease. For most of our series, we'll continue to define it because that is the focal point of what we're talking about. We will define it using the correct KIDIGO criteria. I had explained what KIDIGO was the last time. That is Kidney Diseases Improving Global Outcome. Is an international guideline for most things concerning kidney diseases, an international guideline set out by International Society of Nephrology. And then I will go ahead to describe the relationship between diet, lifestyle, and CKD progression. Then we would understand the rationale behind current nutritional recommendations for chronic kidney disease, that is CKD, counsel patients on evidence-based dietary modifications. It's not just about eat this, eat that. At least you understand why you're doing that and how to do it properly. You, at the end of this lecture, you're going to recognize the importance of individualized nutritional advice rather than, like I said, a one size fits all. You don't. There's nothing like don't eat protein, don't eat starch. Everything is individualized based on the patient's profile, the person's profile. I remember, like I said, this program is not just for those living with kidney disease. It is for those who are not even living with it, because, of course, it's affecting us as a society. And then w- w- to also help with prevention. Like I told you, as nephrologists, our first mark is to prevent the disease. Then, at the end of this, we want to encourage sustainable lifestyle changes and improve cardiovascular outcome. Cardiovascular problems are actually the number one cause of morbidity and mortality in people living with kidney diseases. Involved from nephrologists, that is kidney consultants, dietitians, nurses, pharmacists, physiotherapists, healthcare professionals, even caregivers, family members in achieving optimal patient outcomes. So while we go ahead, like I said, remember to share this link to a lot, share it around, share the link around, subscribe to the channel. We have a Facebook page, subscribe. Let's spread the news around and improve people's life worldwide. Now, chronic kidney disease, why does it matter? CKD really, like I've been saying, it deserves attention because is a progressive disease, and so most times is irreversible. By the time and most times by the time people present without this education and awareness of it, by the time people present, there's been a lot of loss of kidney function. They've really gone beyond the stages. Going forward, I'm still going to explain what the stages mean and what I mean by stages. And of course, when somebody has a kidney problem, a kidney disease with damage, there's an increase of cardiovascular diseases like heart failure, like cardiac arrest, myocardial infarction. There's, those things increase in such people. And like I mentioned earlier, cardiovascular disease remains the leading cause of death in patients living with chronic kidney disease. Now, for people who have kidney disease, they have a higher rate of hospitalization. It reduces their quality of life. So you can imagine you have a problem, instead of going about your business, you're meeting the doctor at least 3 times in a month. That is my experience. I have patients who come to see me in the hospital. They spend they spend time, at least 1 hour, 2 hours of that time. And then if they are not dialyzing, that would mean a quarter of their time per month, or even half of their time per month. And then the likelihood of progression to kidney failure can happen if you have a kidney problem. And if you're not even on the front of prevention, you could just have a kidney problem before you even know it, you're progressing to dialysis or transplant. And I will delineate further why lifestyle modification matters. I had explained it in my preamble, but I'll just list. It will slow the decline in kidney function, which is really true. It will also reduce proteinuria, improve blood pressure and metabolic control. It will delay the need for kidney replacement therapy, that is the need for dialysis and the need for transplants. And then it will also help to reduce cardiovascular morbidity and mortality. I've explained what cardiovascular in this case, things like heart failure, heart diseases, you know, heart enlargement, what we call cardiomyopathy, all those problems. When there's a lifestyle modification, people living with kidney disease, it helps to reduce these problems. Now, we know that there's a growing global burden. We should understand. In my last lecture, I said it and I'll continue to repeat it that about 850 million people worldwide are affected by CKD. And that's approximately 1 in every 10 adults. This is the truth. This is not fallacy. This is not exaggeration. I am not just estimating. This is the truth. Sometimes my colleagues are asking me, what is the problem? Why is everybody with kidney disease? And we get a lot of referrals to show you that is the truth. We have a lot of referrals from gynecology, that is pregnant women and women with women diseases, from pediatrics, children health, from surgeons, surgery. They refer patients to us. Sometimes they even want to carry out a surgery on a patient, and then they find that the patient has a kidney disease, and they have to pause, no matter the emergency, and call us in. And it contributes substantially to disability, to premature mortality, and healthcare expenditure. The money we use to eat shawarma or probably buy gold, you would expend it on take care of yourself, because I mean, if someone dies, that is the end of it for that person. Okay. All right. Now, let's define again what chronic kidney disease is. So, according to the Kidney 2024 clinical practice guideline, chronic kidney disease is defined as a structural or functional kidney damage and or an estimated glomerular filtration rate less than 60 ml per minute per 1.73 meters square for 3 months or more. Now, and as I said, for every of my lecture, I have to define this because if it sinks into our head, it sinks into our subconscious, it sinks into our mental state. People will start into our head, it sinks into our subconscious, it sinks into our mental state. People will start to be aware. They will start to preach the knowledge that this is what CKD means. Oh, this is how it's defined, and then they will go ahead to do something about it. Now, why I say structural, it actually means the way it looks. When you look at the kidney, how it appears. When you do a scan, an imaging, either ultrasound or a CT scan or an MRI, how does the kidney look? Is it abnormal? Then even the kidneys look fine. That is why we use or. I didn't say structural, and I said structural or functional. Even if they look fine, the way the function, the way the kidney works, and that's what we'll measure. Sometimes we use blood, sometimes we use urine, and we estimate it by estimating the functional rate. the total function of the kidney is called the glomerular filtration rate. And if it is less than 60, lasting for over 3 months or more, then this person has a chronic kidney disease. But of course, for you to define this last part, you have to see your doctor. You have to see your nephrologist for that. And like I said earlier, these are the stages we have from grade 1 to 5, 5 stages of CKD using glomerular filtration rate. So Kidigo has staged chronic kidney disease into 5 using glomerular filtration rate. That is a blood work. You estimate it, and then we'll have 1, 2, 3A, 3B, 4, and 5. Then they now went further in later years to add up albumin in urine. That is protein in urine, tiny particles of protein, the smallest form of it in urine. So when people say my urine is foamy, my urine is foamy, doctor is foamy, it's foamy. In Igbo parlance, we say on abo fufu. We want to worry. We start to worry. Is there albumin? Is there protein, tiny protein in urine? And there are stages from A1 to A3. I am taking my time to explain this. Now, when you go to the hospital, you'll be able to ask the doctor questions. I mean, we are behind. We are away from the days of where you just swallow whatever you're told by the doctor. It doesn't work that way anymore. Now, going forward, let's explain further why lifestyle modification matters. Now, it influences a lot of mechanisms. CKD is a metabolic disease. A lot of things affect it. It's a compendium of so many things put together. Even when they say the kidneys are damaged, we start to worry because it will affect the blood pressure. That is hypertension, make it go high. Blood sugars are affected. We have people who have uncontrolled blood sugar. Your body cannot metabolize excess sugar you're taking, or even the normal sugar you're taking. Blood cannot metabolize. It can lead to chronic kidney disease. I mean, the blood pressure itself that I mentioned earlier, CKD can cause it. Blood pressure itself, unmanaged, uncontrolled, can also lead to chronic kidney disease. Then, lifestyle modification, of course, we understand what obesity is. When we have a high BMI, body mass index, when you're too big, bigger than what is expected for your age and for your gender, that's an easy way to chronic kidney disease. Because as you're growing bigger, your kidneys are growing bigger, trying to adjust. At a point, they get tired, and they start to get tired and start to lose cells, or the cells start to malfunction. They get tired, and then it leads to kidney damage. Then, of course, when you modify your lifestyle, it helps to control your lipids, what we call cholesterol. The way the fats of the body, the cholesterol of the body is. If everybody knows what cholesterol is, paining me, and I felt it was my cholesterol. If you can hear me, please, I want you to write yes. If you can hear me, I want you to write yes. Yeah, thank you. I know there are lots of questions. Good evening, baby girl. Good evening, Mr. Miracle. Good evening, Manuela. I know there are a lot of questions. If you can hear me, please write yes on the yes. Thank you so much for writing, MK. Thank you. Thank you. So we can go ahead. Now, so as I was saying, and then of course, when you eat properly, your body, there's something we call chronic inflammation, a state of recurrent injury. Processed food, bad food will cause different types of injury in the body that you're not even seeing, that might look minute, but they will cause oxidative stress. They will bring out what we call free radicals, very bad chemicals from the body, process it and start affecting the organs, which would include the kidney. And of course, it will help to prevent metabolic acidosis that all these free radicals and also will cause. Now, if you eat properly and appropriately and do the lifestyle modification properly, it will help to slow the rate of decline in kidney function. If you don't have kidney disease, it is very possible to prevent it. This is evidence-based knowledge and from clinical experience. I have people who are in stages 4, 5. I have them. I don't know if they are here. They can also say hello to us here. And then we are able, nephrologists, to improve their stages to at least 3A or even 2. There are people that have been on dialysis for a few times and they go off it. Lifestyle modification is key. It will help to improve the blood pressure, help to improve your blood sugar, especially in diabetic patients. It will reduce cardiovascular complications and improve physical function and quality of life. This line is very important because most people, like I said earlier, they believe that once it's kidney disease, start dialysis. I have patients that they come in the first day, you diagnose CKD. You're still telling them, oh, please, you have a kidney damage, it's chronic. But let's see how we can help you and improve the quality of your life, and see how we can improve your stages. Next thing, they've left you, they are in a commercial center, they are dialyzing. I mean, it's terrible. They start dialyzing, fry their kidneys before they return to you. And then there are even patients that you would have defined and told them that yes, you require dialysis or transplant. They run off and start dialyzing on their own. And then next thing, you don't see them again until they are so bad. And I continue to tell patients and counsel them that you can have a kidney disease and live well. I mean, you can go to work, you can come back. There are a lot of patients in a dialysis center. We see them. They come in every day. You don't even know they have a kidney problem, and they come in and dialyze because they have an improved quality of life from care. This is very important. Okay, so the proven benefits following lifestyle modification. Of course, there's a healthy dietary pattern. You even be happy with yourself. You tell yourself, yes, I'm eating well. You know, um, you would get involved in regular physical activity. Of course, part of it would be smoke. You have to avoid smoking. In fact, we tell people to stop smoking. It's very important. These measures have proven benefits. You understand? Weight loss, I mentioned obesity initially, sleeping properly, reducing stress, adhere to your medications. These have proven to have improved benefits in people living with kidney disease. And beyond the kidney, like I mentioned earlier, for it would reduce the risk of myocardial infarction. That is what we call heart attack. You know, you see people they say chest pain, next thing they are dead. It helps to reduce that risk, reduce the risk of stroke, reduce the risk of heart failure. Your heart has failed, not pumping well, not relaxing well. Reduce the risk of frailty. What I was saying initially, somebody would go to work, and somebody who has a kidney disease will not be able to go to work because they are not living well. You understand? And then it will also reduce hospitalization. Very important. Now, okay, yeah. So thank you for being on this channel. Thank you for answering yes, everyone. And we'll continue. I'll try to be faster so we can round off and have our questions. So while we're on it, please share the link, subscribe to the YouTube channel, to our Facebook channel, to our WhatsApp channel, and please prepare your questions. You can start listing them. Once I'm through with the slides, I would answer our questions, all our questions, and explain it to us all. Now, the next slide is talking about how diet influences kidney function. Every meal influences kidney work. You need to understand the way the kidneys are. You can see the diagram. Look at it here. Look at the kidneys. Tiny things that fill the blood vessel. Every single thing you eat, all this food, whatever you eat, shawarma, cold stone, whatever, pizza, gari and soup. Okay, let me share my slides again. I don't think, are you all seeing my slides? Are you seeing my slides? Okay, I will reshare them. Uh-oh. Let me reshare. Can you see the slides now? Are you seeing? I did not show you. Can you see the slides now? Can you see it now? Oh my God, where did you stop seeing from? Okay, let me just do a flip back. Let me do a flip back. Please, let me do a flip back. I'll have to do a flip back. I'm not going to explain them anymore for now, but I'll do a flip back so that people who didn't see the slide before can see them. Please, it's very important that you see how colorful these slides look. That is how beautiful nephrology is, you know, kidneys. So, okay, are you seeing it? Okay, good. So these are it, learning objectives. These slides will even remain on the page, so you would see them. What is chronic kidney disease? Define the different stages using using blood work. Different stages using blood works, different stages using protein in urine. I had mentioned that. Then why lifestyle modification matters, you can look at it. I would also go back over and over again. So as I was saying, now look at the kidneys. See how tiny they are. I'm sure you're seeing the slides now. Okay. Yes. Thank you so much. Thank you. So look at the kidneys. Look at how tiny they are. You see how red they are? That is how vascularized. They're so vascularized. They're made up of blood vessels. So every single thing you eat, every single thing you eat, the oil you eat, whatever you eat, the kidneys will filter is waste. So you can imagine the load. So every meal would influence kidney workload. You know, diet would affect intraglomerular pressure. Glomerulus is is like the measure network, measure structure of the kidney. So it helps to filter, it helps to flow blood. So its work would increase. And because the kidney is affected, it's also going to affect your metabolism. I've told you that the kidney is a metabolic disease. It affects everything. Like I said, once the gynecologist wants to do a surgery on a woman, or wants to manage a woman, or the pediatrician wants to manage a child, or the surgeon wants to do a surgery on a person, no matter how bad it is, if there's a kidney problem, no matter how little, they will just pause and call us. That is how important the kidneys are. And so waste products would accumulate. So for everything you eat, and if you are eating inappropriately, or your lifestyle is harmful, it would lead to increased work on the kidney. The glomerulus that I told you is the measure structure of the kidney doing the work will work too much. It will start to hyperfiltrate, start to, it is clearance of waste product will be too much for it to cope. Then you start to have increased protein in urine. Remember, like I said earlier, protein in urine is also used to stage kidney disease. So once you tell us your urine is foamy, we start to run helter-skelter. We start to run helter-skelter. We are worried. And then it will also lead to you retaining water and salts. You start to swell up. The patient starts to swell up. It will increase oxidative stress, increase the acidity of the body, cause chronic injury, that is inflammation. And when all these things happen, the kidneys start to get tired and they start to lose cells. The singular unit of the kidney is called the nephron. So that's what I mean by progressive nephron loss. You start to lose cells. The kidneys start to lose cells and they start to get tired, and that leads to a damage. Now, it is evidence-based that nutritional therapy can help to reduce all I mentioned initially. So it would improve quality of life. Now, we should understand that, okay, by the side, we are looking at the average blood pressure by age. This is what it should be. For men and for women, 18 to 39 years should be 119/70. For women, 110/68. 40 to 59 years, 124/77. For women, 122/74, and so forth for people above 60. So if you're not living your life the way you should, improving on your lifestyle, improving on your attitude to diet, to exercise, to health care, you would have problems, including blood pressure above these levels. All right. Now let's get down to the tiny bits, because I know the next question will be, okay, doctor, you've been telling us be careful what you eat, be careful with your diet, be careful with your lifestyle, exercise and all. How much can I eat in a day? So the principle here is adequate energy intake. Adequate. I'm not saying you should stop eating totally or eat a particular kind of meal. The thing is here, adequate energy intake is essential to prevent muscle breakdown and protein energy wasting. When calories insufficient, when it's not enough, the body will use up your protein, the remaining protein, including your muscles, leading to loss of muscles. I mean, you're already with a problem, a kidney problem, and then you're not losing muscles again. It would worsen frailty. It will reduce physical activity level. So the current guideline is 25 to 35 kilocalories per kilogram body weight per day. That's what you should eat. So if you're 70 kg, your food should be between 25 to 35 kilocalories per 70 kg per day. Day is 24 hours. And so, like I said earlier, the requirement would depend on your age, your physical activity level, body weight, and composition. So, if you're sedentary, you're probably a secretary, or you're always sitting at the office doing tech or IT, and you're eating 35 because you're 70 kg, you would grow fat. You understand? That's why it's a multidisciplinary thing. You probably will have to meet a dietitian for this. All right. Then our next slide would explain, like I had mentioned earlier, I had said that you need an adequate energy requirement. If that is inadequate, you will end up with muscle wasting, you would lose protein, you would have increased susceptibility to infection. You will easily get infected. If pneumonia passes, you catch it. If malaria passes, you catch it. It's as simple as that. You won't even be able to function. By the time you walk from here to the door, or to your staircase, or to your gate, or to the end of the street, you're already tired. If you have a little wound, it will not heal well. And it will increase your visit to the hospital, hospitalization, and rate of mortality. Mortality means death. So the practical advice is eat nutrient dense food. If you're going to eat, it should be nutrient dense. Thankfully, for those of us in Nigeria, we are able to get such food. And I'm sure for those who are not living in the country, you should be able to accept foods that contain whole grains, that have healthy vegetable oils, eat fruits and vegetables. Of course, this is individualized, because for somebody who is diabetic or has a problem with sugar metab, you're also careful with the type of foods you eat. Take foods that contain healthy fats and high biologic value protein. Now, the idea here is not to restrict. We're not restricting anything. We just want to ensure that you have adequate calories, adequate protein, and adequate calories. For people who already have kidney disease, protein intake is essential. Nobody has said stop eating protein, because people walk in and tell me, doctor, I was told to stop eating protein. And I'm like, why? Who told you to stop eating protein? You even need protein to function. The body cells are actually made up of protein. So who asked you to stop eating protein? I asked that question. And okay, and then when I asked that, and everybody looks at me confused, because they've been told that protein will make the kidneys worse. You understand? Now, of course, if you take protein excessively, it will increase the work of the kidney. The glomerular pressure will increase. The pressure in which the kidneys will work will increase. It will increase the waste the kidneys will have to clear, the nitrogenous weight, and add stress and end up damaging the kidney. But you cannot also stop eating it, because it is essential for tissue repair when you have an injury, for your immunity, immune function, and for muscle mass. So for this, balance is key. And for people without kidney disease, remember that you're eating to prevent it, so you don't go on to having it. So this lecture is not just for people with kidney damage, it is for everybody. And if you don't have kidney disease, I'm sure there's someone in the environment who may have a problem. You may not know what the diagnosis is, but this lifestyle modification is the principle for everyone, whether you're living with a disease or not. Now, for protein intake in non-dialysis kidney disease people, that is for people between the stages of 3 to 5. I had mentioned it initially in the previous slides about people living about the different stages of CKD. Let me show the slides again. So this is it here. We have from grade 1 to 5 on the slides. We have from grade 1 to 5. This is grade 1, grade 2, grade 3A, grade 3B, 4, and 5. Now, for people who are severely ill with kidney disease, you start from 3B to 5. Now, for people who are living between 1 to 3A, those are the people I had just mentioned. And yeah, so let's go back to that slide. For people living, let me go back to it so that. Good. So from people between 3 to 5, actually, who are not receiving dialysis, not everybody with a kidney disease have to receive or do dialysis, who are not doing dialysis. The recommended protein intake is 0.8 gram per kilogram body weight per day. For such people, you avoid high protein diets. Remember, I didn't say stop. I did not say stop. You just restrict it, so that they will have enough for immune function, for muscle repair. You understand? And for their physical activity. Now, when I say high protein diet, I actually mean more than 1.3 gram per kilogram body weight per day. You can write this down, so you can ask the dietitian or do further inquiry. Now, for those on dialysis, we don't generally say stop eating anything, because when especially for those who are on maintenance dialysis, they stay on the machine at least 3 times a week, and then blood leaves their body, enters the machine clears it of waste. The principle is that it clears weight. Of course, you know that there's no all for none rule. Seriously, there's no all for none rule. So what happens is when the machine is trying to clear the waste, it will still clear some good things. That is the truth because it's the blood. There's really nothing to say, oh, the barrier is going to remove only waste. It will remove majorly waste, but it will still remove important nutrients. So for such people, if you're restricting their diet, it will mean that you really want them to run into trouble, and that's not what we want. You understand? So what we want is for you to do appropriate protein intake. Take high quality protein sources, high, we call it high biologic value protein, like fish, skinless poultry, eggs, soy produce, even legumes like beans. You can take them, but of course when it comes to legumes you have to watch out for your potassium and phosphate levels. You understand? Then of course low fat dairy products in appropriate portion. This is very important. So protein requirements should be individualized in everyone, including those with kidney disease and those without kidney disease. It should be individualized in older patients, in frail patients, even in pregnant women, for everyone, even with people with acute illnesses. So the goal is adequate, not excessive, not no protein. Okay, I hope you can all still hear me and you're still seeing my slides. Like I said, continue to put down your questions. If you think I'm too fast, you let me know. Continue to write down your questions, continue to put it down, continue to share the link to everyone, please. Thank you for joining in. All right, so we'll go ahead. Now, for low protein diets, like I had mentioned, what does the evidence say? Several trials and systematic reviews have shown that carefully supervised low protein diet may actually slow CKD progression in selected patients. So, like I said, carefully supervised. Don't just tell yourself, I'm not going to eat beans anymore. I won't eat egg anymore. That is very, very wrong. So, low protein diets in people with kidney disease, the potential benefit will be to reduce the accumulation of waste, those uremic waste that the kidneys clear. It will reduce protein in urine. It will also help to delay the initiation of dialysis in such patients or in selected patients. So that's just it. Now, let's go on to specific diets. For plant-based dietary patterns, we have a lot of people who come in to tell us, doctor, what should I really eat? They will tell you to write down the food. You understand? Write it, write it. Let's see. So, like I said, we don't tell you stop eating this, stop eating that. No, we tell you be careful, and then we'll give you an amount to take. So, for plant-based dietary patterns, we found out that they will help to reduce dietary acid load. They help to improve blood pressure control, lower systemic inflammation, that is recurrent injury in the body. They help to improve the gut microbiome. So what we call gut microbiome is there should be normal bacterial flora. There's what we call the normal bacterial flora that should be in your intestine that should help you digest food and help you clear waste from the intestine. So when you eat these diets, they help to improve those bacteria, the good bacteria in the intestine. Do you understand? And at the end, you have overall improved health. They also help to reduce cardiovascular risk and potentially, at the end of the day, all this thing will slow CKD progression. Then let's talk about the Mediterranean diet and kidney health. This is one of the most extensively studied eating patterns for cardiovascular and metabolic health, with emerging evidence supporting benefits in CKD. Now, the key features, what it emphasizes, what I'm going to talk about is the principle of it. It emphasizes fruits and vegetables, whole grains, legumes, olive oil as a primary fat source, fish and seafood, moderate intake of poultry, limited red and processed meats, and minimal consumption of ultra processed foods. I'm sure we understand what ultra processed foods are. And then, of course, we had mentioned the benefits. So the benefit is still the same if you follow a diet that is engraved in these principles. Okay. Now I'm talking about salt. I will tell us. Yesterday, or was it today? I actually went to see a patient, and I found out that the patient was vomiting and was looking very weak. By the time we did, they checked the patient's electrolytes. We found out that the patient's sodium was too low. The salt was too low. So we find out that people who in our environments, people once they have high blood pressure, what you start to hear is, "Oh, I'm not supposed to eat salt." So about 50% of our patients have low sodium. The normal sodium in the body should be between 135 to 145. But you now find out that these people have low sodium when they come to the hospital and they are weak. So it's very inimical to the body. And because it's not something you see with your naked eyes, people don't know. You see people, they are rushed to the hospital, they are weak. Some of them have lost consciousness. You check the sodium, it is very low. The normal is 135 to 145. You find people having as low as 120. They're not eating salt. And you have a clinical scenario of a husband and wife when they come in, by the time you resuscitate the man, you're like, your salt is too low. You will not start looking at the wife. I told you now. I told you, doctor, every time they're giving me food that is not sweet. I mean, that is the usual occurrence. You find out that people who are making foods for them, they don't even add salt. And I tell them, please allow my patients to enjoy. I'm not, because they have kidney disease, they are not dying today. Let them eat tasteful food. Food should be tasteful. And nobody has said stop salt. What we're saying is to reduce the amount to take to less than 2 grams of sodium per day, or less than 5 grams of salt, because salt is made up of sodium chloride. If you're measuring it by sodium, you take less than 2 grams per 24 hours. If you're measuring as per sodium chloride, totality of salt, that's less than 5 grams, approximately 1 teaspoonful a day. Sometimes I give my patients salt. I give them salt tablets to take. Sometimes I give them salt in drip. So you can imagine. So the idea is not to totally restrict. Really, that is not what it is. The idea is take everything in moderation. Very important. Extremely important. And of course, there are people that will also tell to reduce even to at least 1 gram per day. Everything is tailored to the clinical profile. That's why you have to work in hand with your doctor, your dietitian, and yourself. Very important. You understand? So when you restrict sodium, it helps to improve blood pressure. It helps to reduce, because, especially for people who are in stages 4 and 5. I saw a patient yesterday. They called me and said, please, we need you to see a patient. And I was like, no, I can't see a patient. And he has to be next. They said, please, doctor, come. When I came, the patient said he's worried, he's been fine, but his legs start swelling up. Obviously, he's retaining fluid. For such a patient, I will tell him to reduce his salt intake. You understand? Because if you're retaining fluid and you're taking too much salt, you'll be accumulating a lot of water. And these are the people that will have leg swelling, body swelling, and it adds to morbidity. And then restricting sodium, you're not giving too much work to the kidney. It will help to reduce protein in urine, and it will enhance the effectiveness of how the blood pressure mechanism works. When you see this thing we call RAS mechanism. It's about the blood pressure. It helps to improve its mechanism and, of course, reduce cardiovascular events. Even if you don't go home with anything, please remember to go home with the fact that kidney disease and cardiovascular events are almost one and the same, because they would cure the kidney disease patient faster than any other thing. Now, let us know where this salt is, because somebody can tell me, doctor, I don't put salt in my food, though. But you're putting seasoning cube. You cook with 7, but you will not put salt. I've seen them on social media. They will say she doesn't use salt to cook. I like the way she cooks, but she's adding seasoning cube for you. That's the problem. And then there are people that will say, I was too tired to cook. And next thing, they're throwing indomie into the pot, or noodles into the pot. Then we contain a lot of salt. And then for those who, processed meats, all those asia, sausages, your bacon, the corned beef, canned soup, canned soups and vegetable. You're not buying the fresh carrots, you're buying the tinned one, the canned one, the fast food and takeaway meal. You're too tired to cook. You need to learn to plan your meals in a way that you are able to eat healthy. This is important for everybody, like I said, not just for those with kidney damage. You need to run away from the kidney disease. If you now have it, you need to live a good life. You understand? Of course, salted snacks and packaged foods, you should be careful with them. You should always taste your food before adding. If you're cooking, taste before adding salt. Then cook with fresh ingredients when possible. Use natural herbs like garlic, onions, ginger, lemon juice, and natural spices. Very important. Read food labels. You should be able to compare the sodium content. Oh, this thing contains about 140 grams of sodium. That's too much for me. This contains about 150 grams of sugar. That is too much for me. You find out that somebody will not be taking cubed sugar, but they are licking honey. They're taking honey, they're taking jam, but they're not taking sugar. Isn't that, is that not funny? That's like, I don't know, what's the space of speech again? You're not taking sugar, but you're taking honey, you're taking all that. So those are issues. You should be able to look out for these things in your food. Read the labels. Very important. Therefore, potassium management. Potassium is essential in the body. It helps with your nerve, the way your nerves work, your nerves conducting impulses, the way the nerves work. for you to move your hand this way. Can you see me? I hope you can see me. I hope I haven't left you behind. I hope you've not been left behind, please. All right, good. Okay, continue to put down your questions. I will soon answer those questions very shortly. So if you can see me now, for me to move my hand, it requires the nerve to tell, the nerve will feel the impulse. I want to move my hand. It will inform the brain, and then the brain will tell the nerve, oh yeah, move. It will now move the muscle, and I will move it. That's what we call nerve conduction. And then as I'm moving it, the muscle is contracting. That is muscle contraction. And then the way my heart is pumping, potassium is very essential. In fact, we tell people with blood pressure, take potassium. When you have high blood pressure, want to take potassium. You have heart problem, take potassium. But we're also careful in people with kidney disease. You understand? As your kidney function declines or as the damage declines, you start to find it difficult to excrete potassium. And potassium being high cannot be a problem to the body. So you see that everything is about balance. You understand? Everything is about balance. Very important. Now, the current recommendation for people living with kidney disease is that you have to tell us the potassium based on the individual, because really there are people who are on medications already. If you're taking things like temisartan, lisinopril, you're already on medications that can increase potassium in the body. So you have to be careful with potassium for such people. Depending on the stage of chronic kidney disease, so if you're at the last stage of CKD, chronic kidney disease, you have to be careful with potassium. You understand? But if your potassium is normal, you can eat it. You can take things that contain potassium, which I'm going to list for you very, very shortly. You can take things that contain potassium, which I'm going to list for you very shortly. For example, vegetables, bananas. You can eat that. But remember, it is tailored. It is tailored. And that is why we tell everybody at least once a year, do your kidney function. If there is a problem with it, you repeat it at least once in 3 months, or as according to how the doctor would prescribe for you. And of course, all these foods, I've already seen a question on that. I will still address it, but I must mention it since it's on my slide. While you're preparing the food, electrolyte, these simple minerals and electrolyte, phosphorus and calcium and all, the way of preparation can affect. You can tell yourself, oh, my vegetable contains potassium, and then you put it on fire and boil it for 1 hour. And of course, you know that the potassium would have gone, right? The vitamins and co will not be there anymore. So preparation matters. The way you cook it, like when I'm cutting my carrot, I say, please don't soak carrot for me. Don't soak it. Just wash it. So when you soak even when you're washing your vegetables, you soak it in water and keep pressing. I mean, it's losing its mineral content. All you need to do is to rinse it out in water very fast and very quickly. So preparation is also very important. And then so it goes for phosphorus, phosphate, also very important. It helps with your bone, whether your bone is strong or not. And then if phosphate is too high in the body, it can also cause cardiovascular issues. So those are it. Okay, so for things that are the dietary recommendation when it comes to phosphorus is you have to limit foods that contain highly absorbable inorganic phosphate additives. For example, processed and ultra processed food. So they're not good in any way. Just can push them away. So we would prefer phosphorus that are in plant foods. You understand? Very important. Avoid avoid over processed food because they might contain excess phosphate, which might be a problem for your body. Now, calcium and vitamin D, very important. Very important for bone development. Very key in people with chronic kidney disease, people with kidney damage, because if there's a problem with them, they start to have fractures, start to have bone pain. There are patients who present, and that is their first presentation. They come to tell you, doctor, when you say, doctor, I fell, and I fell 3 months ago, and I'm still having pain. I tell them this is not just a fall. There is a problem. And at least 5 in 10, those people have a problem. They have a kidney disease. And it looks like a joke. And they're like, oh, we've gone everywhere. And I'm telling you, yeah, did you go to the right place? You've gone everywhere. You didn't go to the right place. So those are the issues. And then another thing is, when it comes to calcium, you find out that people, once they just have kidney disease, because they know calcium is essential, they start to take calcium. We don't advise that. We don't just give you calcium because there is a kidney problem. No, because it can even worsen the problem. The calcium can go and sediment on the kidney and cause bigger problems for the patient. So Everything is about balance. Everything is about key. We don't want you to do things excessively at all. Now, for fluid management, initially they will say once there's a kidney problem, not at the stage, reduce your fluid. No, it is individualized. Hydrate properly. In fact, if you don't have a kidney problem, the best thing you can do for yourself is to drink water. Drink water very well, as long as you're urinating it and as long as you're thirsty. At least take at least 2 liters a day. But for those of us in tropics who sweat easily, who are living under the sun, 4 to 5 liters are advisable. Are you urinating it out? Very important. But we want to be careful. People who have heart failure, they have a problem with their heart. People who have advanced chronic kidney disease, they are not making urine anymore. People whose salt volume is low. So you see people, you will come to the clinic, you're already sick, your legs are swollen, you've not been taking salt at all, and you're drinking so much water. That is already a problem. So these things are individualized. That is the principle of it. You don't. It's not a one size fits all. You know, people would you will restrict fluid for certain people, and you would ask certain people to take fluid. For people who are okay, no kidney problem, take the fluid. But if you're already being told you have a heart failure, or you're gaining so much weight, or you're dialyzing, that's when we start to restrict fluid for the person. And fluid here is water. I didn't mention alcohol or mineral at all. Then the next thing is weight management, very important. Obesity. In fact, for obesity is a lifestyle disease. It's a disease. It's WHO is a recognized disease, a lifestyle disease. It's not more about initially when it used to be a social thing. You know, once you're fat, they'll say you're eating well. They start calling you Oriaku or Dogu. No, it's not like that anymore. We don't even want you to add weight. People should lose weight because obesity will cause a lot of things. It will worsen the chronic kidney disease. If you don't even have it, it will start it. Because it will make the kidneys grow so fat. As your body is growing fat, your kidney wants to adjust. Because a bigger body mass index, a bigger body mass would mean that the kidneys are doing more work. So they start to grow big, trying to adjust, and they get tired. Obesity will cause chronic inflammation, chronic injury in the body, around the body. It will also cause insulin resistance, meaning that even when you eat little food, you won't be able to digest it. Even when you're digesting it, your blood sugar will not be metabolized well. The little food you eat will cause you to have high blood sugar. Insulin, the chemical in the body that should help to control that blood sugar, will not be able to do that. And you end up having diabetes. It happens like that. It will cause hypertension. It will worsen hypertension. So those are the issues. So getting your BMI to at least 24.5, very, very important. Modest weight loss can, evidence has shown that even modest weight loss, doing 1,000 walks a day, just reducing your weight at least 4 kg a month can reduce your blood pressure. This is true. It will improve your blood sugar control, that is glycemic control, this thing here. It will reduce protein in urine. It will improve your mobility and quality of life. Of course it will. You won't just lie there and be sending people around. You'll be able to go around and do things for yourself. The strategy here is practical. Portion control. If you are eating this quantity, you reduce it to this quantity. I hope you can see me and you can still see my slides. Okay, good. You're all welcome. Like I said, please, if you have your questions, put it up. If you have put up your questions, we'll soon get to answering questions. And then please share the link to everybody. We're educating the world. We're not just educating people with kidney disease. Share this link. Subscribe to the channel. Subscribe to the Facebook channel, to WhatsApp channel. You're all welcome. And thank you for joining. We'll soon round off. And then reduce intake of sugar sweetened beverage. We know them. The chocolate we take, our ice creams, sugar sweetened beverages, your soda, your cola, reduce it. Regular physical activity, very important. You don't, like, I'm a consultant, right? And then I don't have to sit down and tell people, call the patient. When I say, I can stand up, walk to the door, and call a patient insensitivity. And then regular exercise, we have to preserve muscle mass. You need to preserve, because if you start to lose your muscle, you start to feel weak and tired. It improves mood and sleep is necessary for weight loss. It will also reduce cardiovascular risk and enhance your quality of life. Very important. Like I said, you can, if you have papers, you can start to write. Now, suitable activities I've mentioned before: brisk walking, cycling, swimming, resistance training, stretching and balance exercise, even dancing. You can dance. I mean, of course, I'm not sending you to the nightclub, but you can dance. You know what I mean? You can dance. You move more and sit less. Very important. Very important. This is necessary. Now, Functional capacity and activities of daily living. Living well with CKD means maintaining independence and preserving the ability to perform everyday activity. Functional decline may occur due to fatigue, anemia, muscle wasting, cardiovascular disease, frailty, and reduced exercise tolerance. So look at it. These are all it. Activities of daily living, bathing, dressing, transferring, continence and incontinence care, meal prep and feeding. These are all activities in daily living. They would help to improve your life, improve your health, and improve your outcomes, whether you have the disease or not. This is very important. Now, for people who have declining functional capacities, is a problem. So I have people who walk in, they come on their own to their lives. But when they start to have declined functional activity, you find out that there's a reduced independence. They start to ask for help. They start to burden caregivers. Yes, I know that in our society, in our community, we believe in community life when somebody's sick, but there are settings in which there is no one to even help. So for such people, if you don't modify your lifestyle and end up having a disease, or you have a disease and it starts to worsen and you start to have a decline in your functional capacity, you start to become dependent on people, which is actually a problem. You're dependent. So I saw a patient on Tuesday in one of the places I go to, and there's this man, I wanted him to go run some tests. And the person with him, his son, was saying, "Oh, I will take you on Thursday evening." And the father was saying, "I want it on Thursday morning." And the son was telling me, "Oh, doctor, I have to go to work." So you can imagine the burden. It is a problem. And that's why we advocate for this. Like I said, for nephrology, we are preemptive, we are proactive. Your functional decline would increase risk of falls and fractures. Because you're tired, you might not even be able to reach out for your medications. You stop to adhere to them. It would not mean that if you were just visiting the hospital like once a month or once in 3 months, you even start getting admitted. You understand? So these are all the issues. There's an increase of caregiver burden, which is a problem. A problem. So we have to encourage patients to remain as independent as possible. Even you, personal hygiene and grooming, dressing and mobility, your meal preparation, shopping for groceries, household chores, medication management, planning for your meals, even includes shopping. You go to the market and choose what you want, what you need for yourself, how you will prepare it. Education is necessary, knowledge is necessary. Functional ability is a better predictor of quality of life. This is very important, extremely important for all of us. And of course, if you would need help and you want to maintain function, of course, you maintain your diet, you optimize, make sure your nutrition is optimized. Make sure, of course, you go for regular checks to a doctor who will check, is your blood level reduced? Are you having a problem with electrolytes? If you need assisted devices, you get them. If there's a need for physiotherapy, there are people who have been ill, and then by the time they leave the hospital, maybe they've had a stroke or something, they will need therapy. They need occupational therapy. They need physiotherapy. Even people who are living with kidney disease, they've been ill for a long time. They will need therapy to improve. Now, for many patients, remaining employed and socially engaged contributes significantly to emotional well-being. So usually I tell my patients, the aim here is to remain employed, remain financially stable, and maintain your self-esteem. So you see why you have to be functionally stable by adapting to this lifestyle. Whenever possible, patients should be encouraged to continue working if medically fit. Yes, I tell them, continue. What the other one tells me he sells paints. I asked him, "Do you paint yourself?" He said, and I said, "Okay, if you don't paint yourself and you're not exposed to paint, you can sell." By the time I saw him Wednesday, he told me, "Doctor, I've started going to the shop." I was happy. Maintain your regular work routines, preserve your physical and mental health. Plan your dietary schedules around your work commitments. It's very important that you feel like you're still giving back to society. It is very important. It's a kick to help you wake up in the morning and sleep better at night. You understand? You can ask for flexible working hours, ask for rest breaks, very important. Reduce heavy lifting. Make sure you have access to drinking water and to the toilet. Now, for people who don't have kidney disease, we'll tell you, please do not hold urine. Some people will probably tell you, "Doctor, I don't urinate outside from morning to night. I have my urine." Please, we don't want that in nephrology, in kidney. Please make sure once you're pressed, go and urinate, because if you're maintaining toxic weight in your kidneys, in your bladder, there may be a backflow and you're causing injury to yourself. You understand? So, like I mentioned earlier, we expect you maintain social participation no matter how ill you are. This is what lifestyle modification will help you to do. I have patients that will tell me, "Oh, doctor, please." I will tell them, "Please, I want to see you in a month." Doctor, no, I can't make it in a month. I'm going for a burial, or we'll have a meeting in the church. I'm the leader. It makes me happy. So we expect that you continue with your hobbies and recreational activities. Very important. Then for the psychological benefits, maintain social engagement. This can help to reduce depression, anxiety. It will help to reduce treatment burnout. CKD should not define your identity. Your kidney do not define your identity. A patient should be able to function as able as they can. You should be able to carry out social participation, carry out your work, and for people who don't have it, do not be obsessed with the idea of it. All you need to do is employ these principles and you have improved outcomes. Hmm? Okay. Thank you for joining. Thank you. Okay, we'll soon be rounding off. We'll be rounding off now. I think we're going on to the last slide now. We'll take the rest next week so we can get questions. Now, of course, modifying your lifestyle, work, social, your feeding, nutrition, exercise will help to reduce fatigue. And so I think for now we can take questions from the slides so far. We can take questions. Thank you for joining. Continue to share the link. So I will start from the very beginning. People who are asking questions. So we have okay, so Vivian is asking how long before the symptoms start to manifest. So the thing is, for chronic kidney disease, there's really no, like I said, one size fits all kind of thing. It really depends on the precipitating factors, the factors that are leading to those kidney disease. Let me give you an instance. You have somebody who has a high blood pressure, and because they've had a high blood pressure over a long time, they develop. But from stage 3B, stage 4 to 5, you start to notice the symptoms at all. I have a patient in 2023. He visited the doctor just that once and went away and continued taking his medications. And that is the issue. What we really expect is that you have to continue to visit your doctor because they will tailor your medications according to your profile at each point in time. And profile is what they see when they examine you, what they feel, and then the test. So this person went away and now came back with end-stage kidney disease. You understand? So symptoms will depend on the trigger. They cause what is causing the kidney disease. That the symptom will depend